organs too.
All right. Well, welcome everybody. This is our first YouTube live from She Found Health. We wanted to follow up on the labor and delivery series that we did that you can find on our channel as well. So while we're waiting for people to log on and start posting some questions, we have some from our Instagram at she.found.health. We'll just go through a couple of logistical issues. So first thing we wanted to talk about was make sure that you, in the chat function, you can add any questions that you've got in there. And then we just want to mention that this YouTube Live and all of our content is for general medical information only. So none of it is supposed to be direct medical advice, and we do not want you to take it as that. The purpose of this is to inform you so that you can have a proper discussion with your care provider about your particular issue, and that should be the advice that you follow. So make sure that you subscribe below. We really need people to subscribe and follow us, and make sure you comment and are interactive with all of our videos. We really like to get those questions and concerns and see what you think. And at the end, we'll post under here our packing list and our birth plan template and our top 5 tips people make mistakes that women make breastfeeding. So check out those below if you are interested in those. So why don't we get started?
Yes. So we got some questions from some of our Instagram followers, and we thought we would start with those while people are figuring out the technicalities of the chat box. So one of the first questions is, what's the deal with my mucus plug?
Yeah.
Is it a thing? Do I need to worry about it passing or not passing? So I think that's a pretty simple way to start.
Yeah.
Yeah. So your mucus plug is a little collection of mucus that typically forms at the just at the outside of your cervix, and your cervix is the passage between your vagina and your uterus that has to open up and dilate when you're in labor in order to pass the baby through. And typically, but not always, your mucus plug can pass, I would say, anywhere in the last month of pregnancy.
Yeah, I usually say if you pass your mucus plug, it means you're going to have a baby in the next 4 to 6 weeks.
Yeah, exactly. So it's not, is it a thing? Yes, but does it really matter? No, unless you're having significant amount of bleeding.
Yeah. So the mucus plug is basically, it's a little bit of mucus that sits in the middle of your cervix. So your cervix is a long tube. One side is your vagina, outside. The other side is your uterus. The baby is there. And so as your cervix starts to change, it softens, it starts to shorten a little bit, which naturally happens after 36-ish weeks, that mucus plug will then be expelled. That mucus plug is like a booger of your nose. It's like snot, it's mucus.
Like a booger of your cervix.
Yeah, cervix booger. And it has a little bit of blood associated with it. So sometimes it can be brown. Sometimes there can be a little bit of bright red blood. There shouldn't be a lot of spotting or heavy bleeding associated with it though. So when do we worry about it? Well, if you're passing it before 37 weeks and you're having significant cramping with it, that we worry about. But if you're passing it before 37 weeks and you're not having significant cramping, probably not an issue. Probably a good idea to go get your cervix checked with your primary care provider. They can just do a quick exam. Especially if you've had a totally normal pregnancy. Now, if we know you have a shortened cervix, or if you've been followed for complications like placenta previa in your pregnancy and your preterm, then that's a different story. But if you're term, you've had a healthy pregnancy, losing your mucus plug is not a big deal, and it's totally normal, and it does not mean you're going to have a baby in the next couple days. Some women get really excited about losing their mucus plug and then really disappointed when they don't have a baby a couple days later. So just means you're going to lose it you're going to have a baby within the next 4 to 6 weeks, probably.
Yeah. So I would say if you're after 37 weeks and you pass your mucus plug and you're not having any heavy bleeding, you're not having regular contractions, just let your care provider know at your next visit.
Yep.
You don't need to call us in the middle of the night to let us know.
No.
Just let us know at the next visit, unless you're having one of those things.
Yeah. And if you're before 37 weeks and having kind of regular uncomfortable cramping, then call us right away, please. Yeah. So another thing that we forgot to say is we are filming this, if you're watching it afterwards, in the time of COVID-19. So some of the questions we got relate to kind of COVID-19. So we're going to answer those in both current state and hopefully future state when we're all back to normal. So we'll kind of go through those. So the next question that we got, and again, for anybody who's just joined us, if you have questions, just type them in the live chat next to this so that we can answer them as we're going the next question we got is, what are some reasons that we should be calling our care provider during pregnancy?
So that is a great question. And there's tons of different reasons why we would want you to call. So we went through and sort of wrote out the sort of most significant reasons we would want you to call us. And specifically, we'll start with reasons to call before 37 weeks. So if you're before 37 weeks and you're starting to have symptoms of labor, so that would be regular cramping and sometimes preterm labor, or what we call threatened preterm labor, can start pretty mild. But if you're having mild regular cramping, like menstrual-like cramping, or just this like mild ongoing low backache that is new, increase in vaginal discharge that is new associated with that mild cramping or more than mild, we would want to know about it. And we would want you to call us. Every care provider works a little bit differently. So in the group that Alicia and I work in, we are in the office a handful of days a week, and there's always someone on call. So you can always try and phone the office. And I suspect this would be appropriate for any care provider, and see if you can get a hold of your care provider that way. And if you can't, in this case, I would call the on-call care provider and just let them know what's going on. They can manage a lot over the phone and figure out if you actually do need to come in and be assessed.
And generally that mild or moderate cramping, we kind of say every 5 to 15 minutes. And even if you're resting, it's lasting for more than an hour. So if you lie down and it goes away, fine. But if you lie down and it's still persistent, even if it's every 10 or 15 minutes, if you're 34, 35, 36 weeks, we want to know about it. If you're 38 weeks, then you're probably in early labor. Awesome, right? You don't need to call us. As long as you're coping well and you haven't been told specifically you need to call if you're in early labor after 37 weeks. But if you're before 37 weeks and it's not settling down with rest, it's been going on for more than an hour and it's regular, like every 10 minutes or every 15 minutes or every 5 minutes, or it's getting stronger, please do call us. So the next thing that we want to hear about is bleeding. So a little bit of spotting here and there throughout your pregnancy can be totally normal. Early on in the pregnancy, throughout, we don't always know why, but we kind of want to hear about it. So if you have a little bit of spotting, baby's moving well, no other concerns, please let us know at your next appointment. But certainly if you're having ongoing spotting or heavier bleeding, again, if you're less than 37 weeks, we want to know about it. Over 37 weeks, heavy bleeding, we certainly want to know about, so call us. But spotting after 37 weeks is most likely your cervix shortening down and opening up. There's lots of little vessels in there that can kind of break and bleed. Totally normal.
The thing I always say to pregnant women is there's no such thing as crying wolf in pregnancy. You know what? If you're worried, call. Even if you're like, oh, it's just brownish spotting, I think it's okay. If you're worried about it, call us. Trust that sort of your maternal instinct, that gut. And we're happy to help. And no matter what is going on, if you're feeling worried, we want to know. We want to help you.
Yeah, so important to listen to your gut. The next one that we want to talk about is fetal movement. So fetal movement after 28 to 30 weeks should get pretty consistent. So your baby should have its own pattern. It's going to be different than other people's babies, totally fine, but you should get to know your baby. And most of the time during the day, if you're active, you're rocking your baby to sleep. And then once you lie down at night, they're waking up to party. So they get a lot more vigorous, or you're just paying more attention to them, frankly. So if your baby is dramatically decreased in its movement, we want to hear about it. So 6 to 10 movements in a 2-hour period is normal. So if you're worried, my baby's a little bit quieter than normal, we want you to sit down, put your feet up, really focus on your baby, have a glass of water, and count those movements. If you're getting 6 to 10 movements in the first 5 to 10 minutes, then get up, be on your way. You do not need to sit down for the whole 2 hours. And if it takes 2 hours, then because they have sleep-wake cycles, just like we do. But you're getting those 10 movements and things have picked up, perfect. But if your baby is still quiet throughout that 2 hours and you're not getting those movements, then call us. We really want to know about it. So anytime after 28-ish weeks, we want to know if you're worried about your baby's movement and you've sat down, counted for a couple of hours, baby's still not perking up and you're still not feeling baby, call us, please.
Yeah, and I think that's really important because even myself as a care provider in my first pregnancy, I had to have a procedure done where I was in the Trendelenburg position.
So that's head down,
head down. I think I was like 34 weeks. And then I got home and I could feel my baby moving, but it didn't feel to me the same. I could still feel it moving, but I was worried. And so I phoned my doctor and she actually brought me into the hospital and did a fetal heart rate tracing. And that really reassured me. And we're happy to do that for you. So if your movements just feel different, not the same, and they do change as you get closer to term. But if there's something worrying you, trust that and call us.
Yeah, and those movements, they change as your baby gets more squished in there. So they're not as vigorous.
Yeah.
but they're more shifty, but
Yeah.
they should still have those movements.
Yeah.
Okay.
The next thing that we would want people to call us about is significant pain, and especially if it's kind of sudden in onset. So unfortunately, there is a lot of pain that can be associated with pregnancy. So back pain, hip pain, pubic symphysis pain, rib pain,
breast pain,
everything, right?
Head pain.
But typically, those types of pains start gradually and build up. Do we want to know about them? Yes. But we're not as worried about them as a pain that is really severe, really intense, and comes on quite suddenly, especially pain that's in the abdomen or around the uterus. So if you're having a pain that's new or just comes on suddenly and sort of, sorry, I shook the table there, guys, and sort of grips you, we don't want you to just ignore it. We want you to call us. We'll talk it through, and then we'll decide if you do need to come in and be seen.
And like we talked about before, like Dr. Sarah said, listen to your intuition. If you are really worried about something and you're going to be up all night worrying about it, just call us. Don't call us to find out when your appointment is 2 days from now. It's an emergency line. But if you are truly worried about something and you think there is something going on, please do call. Your care provider will be more than happy to hear from you in those situations. Okay. So the next question that we often hear from, and somebody on Instagram asked, is cervical sweeps. What are they? What are they for? When do we do them? And again, we have, this is to help prepare your cervix. And we've got that sheet below for perineal massage, so preparing your perineum for delivery. But cervical sweeps is essentially, we start usually offering them I offer them after 38 weeks. We're all a little bit different again. A lot of these answers are ish. There's a few things that we're hard and fast about, but most of it's more of a gestalt and more of a kind of an ish answer. So I start offering cervical sweeps at 38 weeks. Other people do it at 39 weeks. Most of us won't do it early unless we're going to plan to induce you early. Then I'll offer them early, but don't tell anyone.
Yeah, I'm the same.
So what it is essentially we put our finger through your cervix and we run it through your cervix and we try to separate the amniotic membrane from the inside of your uterus very gently. Put it in, sweep around. So that releases prostaglandins and it can help soften up your cervix and help start kind of the dilating and the softening program. Oftentimes you'll get some crampies with that. You can certainly get some spotting with that afterwards, not to worry, as long as it's not heavy bleeding and it simmers down after a couple of days and turns brown, goes away. But the evidence shows us if we start doing that at 38 weeks, twice a week, we decrease our risk for needing post-dates induction. So induction at 10 days after your due date. We have to give 8 women cervical sweeps to prevent 1 post-dates induction. So it's not bad, but often it can just start getting that early labor work going so that early labor process doesn't have to be quite as long. If you've watched our videos, which we've linked below, that can go on for days, the early labor. So the more we can do to help shorten that phase, the better, in my mind. But again, we offer it. By no means do any women need to get a cervical sweep. Some women don't do it until they're post-date. Some women don't want to do it at all, and that's totally fine. It's 100% your choice. This is nothing that's medically necessary. We just offer it because some women just want any help they can have to have their baby already.
That was me with my 3rd baby. I went for sweeps twice a week.
That was me with both, well, not my 2nd. She was a feisty little. Anyways.
Unless you have been told no one to put a finger in that cervix or anything in the vagina, and then we will not be sweeping you.
Yes, true. Okay.
Okay, another question we get is, after I've had my baby, how long do I typically stay in the hospital? And again, this is a little bit different depending on who your care provider is.
I'm just going to make sure this chat function is working. So if anybody wants to try it out,
hi.
Please do.
Hey there. Hey there. So it's going to be different based on who your care provider is. So in our local community, primary care is done by midwives and family physicians. In many other communities, primary care is done by midwifery, family physician, or an OBGYN. So your care provider has likely different practices, and then also the type of birth that you've had will have sort of dictate, as well as what number birth this is for you. So typically, say this is your first baby and you had an uncomplicated vaginal delivery, on average, you're probably going to stay 2-ish days. And sometimes that can be a bit weird because if your baby was born at like 5 a.m., then you may actually just stay 1 or 2 days. It just sort of depends. Exactly.
48-ish hours, give or take.
Exactly. So, and typically what we want to make sure is that you can pee well. Your pain is under control. Your bleeding is, what we would consider within normal. And that you can feed that baby. That is the most important thing that you need to have confidence in and to be established before we're happy to send you home.
And the nurses, the mother babe nurses, most of them are great at helping to kind of work on that breastfeeding. And so that's really the big piece of why first time moms are in for a couple of days. Second time moms can go home a couple hours after delivery if they really want to. Some want to stay overnight because they have a toddler at home and they want to just have some time bonding with their baby, but they tend to go home after 24 hours or so. After cesarean section, it's a little bit different. We usually keep first time moms 3 days, give or take, just because they've got the pain to manage as well. You do have pain with a vaginal delivery, but it's a little bit different than after a cesarean section. And so we want to make sure that you're able to get up and mobilize and go to the bathroom by yourself and be able to kind of do what you need to do to support you and your baby. So usually 3 days for post-cesarean section moms for first baby. For second or repeat babies, it's usually more like 2 days. So, and then during this COVID-19 time, we're trying to decrease the amount of time moms and babes are staying in hospital as long as they're comfortable with that and it's safe for babies. So that might even be shortened, but if you don't feel comfortable going home, you will not be sent home earlier than you're comfortable. We can't keep you for 5 days. It's not a hotel, but 2 to 3 days is pretty typical for a first time mom, and 2 hours to 2 days for a second time or third time mom.
And something else that other than breastfeeding is if your baby is jaundiced. So sometimes if your baby's a little jaundice, a little bit yellow, and we will do a post and a video about jaundice in more detail for you. But sometimes those babies, we need to follow in hospital a little bit longer. And we prefer to keep mom and baby on the mother babe unit together because if we discharge them home, we continue to follow them in the community. But if that baby needs to come back in and have treatment for their jaundice, they typically have to go to the peds unit. And then it's just a little bit more complicated and not quite as comfortable and easy to sort of be relaxed and feel well cared for on the mother babe unit. Because peds unit, sometimes you're in a mixed room.
The peds nurses don't know how to manage breastfeeding a lot of the time. Some of them are excellent, don't get me wrong. But so they just a little bit more support on the mother babe unit in terms of the postpartum mom and babe dyad stuff. Peds unit is amazing for the pediatrics, amazing for the babies, but they don't have that same kind of skill set for taking care of both mom and baby. So you're more of a well companion on the peds ward. You have to get your own food and stuff like that. So so the other question that we often get is around epidurals. So first of all, epidurals, it's again totally up to you. You can choose to have an epidural or not have an epidural. Whether you want an epidural or not is 100% up to you and how you're doing in labor. Nobody knows how they're going to manage in labor, and it depends on so many things. The position of your baby, how your actual day is going. If you and your partner had a fight earlier, you're going to be more susceptible to pain than if you had a lovely, relaxing day. And that's just human nature. And none of us have ever, most of us, thankfully, have never been in that kind of challenging time before. So I don't know that we can ever go into anything saying, I want this or this or this. You have to be kind of open-minded. But when is it too early to get an epidural? Well, if you're not in active labor. So what active labor means is regular, strong, painful contractions that is dilating your cervix, and your cervix is now kind of 4-ish centimeters at least. That's when we can get you an epidural. The other time that we can get you an epidural before that is if we're going to be inducing you. So if we're going to be giving you medication and it's to get your labor going, we can give you an epidural before that. So that's kind of when is it too early. If you do it before you're in active labor, so when you're still in that early labor phase, then certainly it can slow down your labor. If you're in active labor, an epidural will not slow down your labor. Sometimes it actually picks it up if women are in so much pain and they're just clenching everything tightly and they're not letting their pelvis open and their baby come down. And then when is it too late? Rarely is it too late. If we think you're going to have your baby in the next 10 minutes, it's too late because it takes 15 minutes for that epidural to kick in. But I know we've both given epidurals. I've given epidurals to women. I haven't. I've asked the anesthetist to insert an epidural for women who've been pushing for over an hour already. So it's not a too late, too early type of, it's just when is it right for you? And that's just a decision you make at the time. And you may have your heart set on an epidural and go in and actually cope with labor well and not need one. Or you may think that you're going to do it without, and it just doesn't go that way. And that's okay. So just figure it out in the time. There's no judgment. There's no need. There's no we're just here to support you, and that's the general rule of pregnancy.
Exactly.
Yeah. Can I just say how cute this picture is behind us?
Oh,
We have these little baby pictures, and I keep seeing it. Sorry,
I know, that's okay.
we're not socially distancing.
It's okay. I'm negative.
Me too.
PCR. And our next question was a COVID question. And that was, do all moms have to wear masks in labor? So when you come in labor, do you need to wear a mask? Right now in Victoria, so again, this is different in every center. And even we are island health, but it may even be different across the island. So right now in Victoria, a pregnant woman is not required to wear a mask unless she is symptomatic. And so when we talk about COVID, we talk about either someone who has been known tested positive, or they have new symptoms and they're being investigated for COVID. So those are the two situations when you would have to wear a mask. Otherwise, right now, the patient, the woman, the client herself does not have to wear a mask. All care providers will be wearing masks. And that is to protect both us, but more so you from us breathing and dropping droplets out.
Well, and us as well, because we can be without symptoms for 3 to 5 days prior to actually getting symptoms. So if a woman comes in and for whatever reason they've been exposed and they're shedding symptoms, but they're shedding virus, but they're not symptomatic yet, then it does kind of protect the healthcare workers. So it's for everybody's protection, frankly. Yeah.
And then another COVID question, somebody had asked if their partner was an essential worker and unable to self-isolate, would that inhibit them from coming in to support them in birth? And right now, that is not the case.
As long as they don't have symptoms. So any support person who has symptoms currently cannot come into the hospital because they will expose everybody there, including other moms and babes, right, to COVID-19. But if they do not have symptoms, then they can come in. Same with us. If we don't have symptoms, we can come into work. But if we have symptoms, we can't come into work. So.
And we would ask that you really be diligent about being truthful about this. There have been some cases, unfortunately, where some partners have lied and they've actually been symptomatic and have spread COVID around hospitals. And you know, it would be heartbreaking to have to change your plans, but the devastating effects that could happen if you were to spread the disease is just too much of a risk to take right now. So that's why, if possible, we're asking partners and women to socially distance and self-isolate as much as they can. Essential workers, the benefit that most of us have is that they can get tested. So if your partner does have symptoms, just try and get testing as soon as possible.
Yeah, and we have better access to testing now.
Yeah.
Certainly.
Yes.
So that's good. One thing we did not talk about in our labor delivery series that we did want to do, and again, it's very much Victoria specific. So if you're not from Victoria, we apologize. But it's very much Victoria specific, is the logistics of the Victoria General Hospital. So when people are coming in because they think they're in labor, we park in the parking lot that's on the other side of the hospital than emergency. If it's overnight, then you can go in through that entrance, the one by the Tim Hortons, if you've been in the hospital, and there's just a buzzer on the right-hand side of the door that you buzz. The security people will see you, they'll see your belly, and they'll just let you in. So you don't need to go in through the emergency side. And then you go up to the third floor of the hospital and present yourself to labor and delivery. If you think that you have COVID symptoms, please call your care provider if you are in labor or not, and we will figure out a way. We'll create a safe way for you to come in. And that just means us calling ahead to labor delivery, getting a room set up for you before you actually arrive. So make sure if you think you're in labor and you have respiratory symptoms and you're the delivering human being, because you have to come in if you're in labor, then make sure you just call us ahead of time. Call your care provider ahead of time.
And right now, the silver lining to COVID is that you don't have to pay for parking.
Yes. Or private rooms.
Oh, yeah, because we're trying to put everyone in single rooms.
Just got to look at the positives.
Yeah, exactly, right. And better breastfeeding rates right now.
Yeah, breastfeeding has improved dramatically because there's not all these visitors coming in and interrupting that time with your baby. So we know it's a challenging time. We totally appreciate that. And we thank you all for your patience and support and diligence during this time. In Victoria, essentially, we've done an amazing job. So we just need to keep it up. But there are some kind of positives that we have been seeing out of it. And the other thing about, we don't have to pay for parking. In non-COVID times, if you are actually in labor, buy a week parking pass. It's the cheapest. You're going to be in for 2 to 4 days, depending on how long your labor takes.
Just to scroll to the second page of the...
Yeah, so that's just that little...
annoying.
bit.
Yeah.
Okay.
Yeah.
And also in non-labor times, if you've taken a prenatal course, like our prenatal course that doesn't have a hospital tour with it, you can get a private hospital tour, and you just call the labor delivery ward and they set that up for you. So that's just another piece that some people ask about as well. Yeah. Does anybody out there have any questions? I'm not sure if this, do you want to sign on? If this chat feature is working because nobody's actually responded to my hey there.
We can see you there. I know you're watching.
But those kind of are the questions that we've gotten up until this point. So again, we've got our links to the birth plan, if you have a birth plan, and again, we have a video around that. And essentially, it's about plan is how to create those conversations with your partner, with your care provider, to kind of get the best birth experience that you can in a realistic way. We also have a packing your bag one. That's kind of a fun one. Just what essentials do you need to bring with you for yourself, for your partner or support person, and for your newborn baby? No, I was like, oh, that's so nice.
That was
that's
for me.
Sarah saying that. And then the third one is we have how to prepare your perineum for labors to help reduce kind of perineal trauma. So those three are linked down below.
Yeah, I'm
just scroll down to see if there's any comments. No. All right.
One other question. So we did a survey, and another common question we got, not specifically relating to labor and delivery, but sort of the latter stages of pregnancy was oh, sorry, I keep putting my elbow on the table, guys. When should I come off work?
Yeah.
And that is not an easy question to answer, but we can give some general guidance around that. Yeah. So it is going to be unique to every situation. So the person, their symptoms of pregnancy, and the work that they do. So some women work right up until literally they go into labor, right? And I would say that's pretty common in a lot of cases. And even women who do shift work, a lot of physicians on call, they work well into their third trimester. And the reasons for that can be different. And so that is, if financially they need to, they really like their work, they can't find someone to cover their work. And the risk, we know that as long as your pregnancy is progressing well, the baby's growing well, and there's no other concerns, then that's totally safe and appropriate.
Yeah, for sure.
Yeah.
If there's concerns, then we'll often take you off work earlier. So if you have medical issues like high blood pressure or baby's not growing well, or you've got significant pain for whatever reason, we can certainly, but we do that on an individual basis. But most women work up until 36 to 40 weeks. I know with my son, I worked up to 39 weeks, and my daughter the day before she delivered, which was earlier. But
good. You go, girl.
Well, it was not intentional.
No.
Okay, we do have a question. Yay, thank you. So can partner go in and out of the hospital as we are supposed to remain in the room during labor and delivery? No, they cannot. So once you're on the labor delivery room, your partner needs to stay up there with you. They cannot come in and out of the hospital. Once you're on the mother-babe unit, so after you've delivered and you're transferred over to the mother-babe unit, yes, they can come in and out of hospital at that point. We do want to minimize kind of ins and outs, just because as people are passing and using the elevator, it's just kind of increasing risk of exposure. But after that delivery process, when you've been transferred to the mother-babe unit, then they can kind of come in and out. So making sure when you're packing your bags, you're packing snacks for a long time.
And even bring
first labors, bring
a
little
cooler, soft cooler bag.
Or a hard one, whatever.
Or
we have ice machines so you can refill your ice and stuff.
Yeah.
But certainly that first labor can be long. So make sure you have lots of snacks for 24 hours for your partner. Laboring moms, we have food for. Usually if you're laboring, you're not eating much, but your partner needs to eat. So you can bring a thermos full of hot coffee if they're coffee drinkers, a cooler with lots of snacks and healthy foods. And then after you've had delivery, partner can leave, go home, shower, get some more food, change their clothes, whatever.
Yeah.
And making sure also, just speaking of changing your clothes, that you bring like deodorant for your partner, a toothbrush for your partner. They don't have horrible breath when they're helping support you.
Because they're going to be one holding the baby while you rest.
Yes, exactly.
Yeah.
So, great. Any other questions that anybody has?
We're happy to answer them.
Yeah.
We can also just keep chatting because we're so good at chatting. I was looking through that. Okay. Constipation and pregnancy was a really big question.
Yeah.
That some people are not comfortable talking about or asking about.
Constipation and hemorrhoids. We're going to do a video on that too.
Oh, girls, we're going to get so into that. But it's very common.
Yeah.
And you don't have to suffer with it.
No.
So if you are constipated, having trouble passing your bowel movements, or you're having hemorrhoids, talk to us about it. Talk to your care provider, and we can help manage it.
Yeah. And a great website that we want to get everybody to go to if you're hoping to breastfeed, if that is your plan, is a website called firstdroplets.com. It's great. It talks to you all about, it's a lactation consultant down in the States who's so passionate about breastfeeding. And she goes over kind of hand expression, how to get that first latch, the importance of skin to skin right off the bat. So this first kind of few hours to days, it's an amazing resource. So really check that out if you haven't heard of it before.
Yeah.
I just learned about it and it's phenomenal.
Yeah. I know. We've linked to it, I think, in our breastfeeding post, one of our breastfeeding posts.
And also in our online
prenatal course.
Yeah. So great. Well, if there aren't any other questions, I guess we'll end it there.
Mm-hmm.
Thank you so much for joining us. Hopefully this worked well. We'd love to hear what you think. So write a comment or two down below. Just, did it work well logistically? Is there any other way that we should do it? And have a lovely day. Enjoy the sunshine.
Thanks, guys.